Hi everybody, I'm Dr. Jon LaPook, medical correspondent for the CBS Evening News with Katie Couric, and welcome to CBSDoc.com. This week we're going to talk all about hypochondria. Now we all have the potential of being a little bit of a hypochondriac, right? But the question is, when does it become a problem?
This is your fault. This is the fault of your profession. His profession, the medical profession. What do they say all the time? What's the most common sign that you're sick? Flu-like symptoms, right? Flu-like symptoms could indicate the flu, could indicate, an overheated room, or could indicate dengue fever, tumors of every kind. So it's perfect. It's not that much of a leap. Listen to me. It's not that much of a leap to go from I have the flu to, maybe I have a steadily advancing tumor that has never been detected.
Here to discuss this, my good friend and colleague at CBS, Richard Schlesinger.
And sometimes hypochondriac.
Or at least he thinks he is.
Yes.
And
I'm Bill Fisher. I'm an associate clinical professor of psychiatry at Columbia University.
all right, so first thing is we're going to talk about what is the definition of a hypochondriac?
Well, a hypochondriac is somebody who has a preoccupation, an intense preoccupation with the idea that they have something seriously medically wrong with them. It has to be so severe that it actually causes extreme distress or dysfunction in their life, has to last for at least 6 months, has to be immune to reassurance by their doctor, and not due to some other psychiatric illness.
So Richard, did you really think that you had dengue fever?
No, I didn't think I had dengue fever, but people do worry. And by people I mean I do worry sometimes when you have these sort of flu-like symptoms that you guys are so fond of describing.
Right.
You wonder if it's the flu or if it's something more severe. So that doesn't make me a hypochondriac, though?
No,
or does it?
Well, not quite. You haven't met all the criteria yet.
Does it give them any illusion of control? If I'm worried about it, then it's not going to happen to me, or
There's an element of that we're all very much afraid of all that unknown that's out there. We all want to have the illusion that we're in control of what happens to us and what happens to our body, and we feel that somehow by anticipating the worst, we can gain control of it.
And especially when you have a friend or a family member, a loved one who's gotten sick, the hypochondria can start kicking up, right?
Yes, and in fact also a personal history of having been sick.
My question is, how do you deal with that as a doctor when patients come in? You have to take it seriously up to a point, don't you?
Yes, absolutely. It could be something. So you never want to blow any symptom off. You have to do a complete review of systems. But there's something called the positive review of systems, where you go from head to toe and the person says yes to everything, including, does your urine glow in the dark? And they say, oh yeah, I have that too. And then that's a problem also, and you have to try to figure that out.
We all get worried about, oh my God, I have this or I have that. But I think it's important to make the point that these folks are really in serious distress.
It's a big league problem,
Yeah.
and it's terrible when people really are hypochondriacs and meet the actual DSM-4, is it now?
Yes.
Criteria for the disease. But the rest of us are really hypochondriacal,
Yes.
right?
Right. There's a reason I'm not the medical correspondent, in addition to the fact that I'm not a doctor, but at one point I had to substitute for the medical correspondent in the evening news for a week, and I did 4 stories that week and had four diseases.
I have to say that your belief that you're a hypochondriac is entirely hypochondriacal.
I'm a hypochondriac. Hypochondriac?
Yeah.
That's wait a minute. That's a double problem.
You're not even a real hypochondriac.
If I were really a hypochondriac, would I be able to sit here and talk to you about this, or would I be convinced I'm dying?
No, you certainly wouldn't be amused by it the way we all are. You would be convinced, and nothing that your doctor could say to you would reassure you, maybe momentarily, but you would immediately move on to thinking how they could be wrong.